We came to this country in 1991 from Canada, so I'm first-hand experience both as a consumer and a provider in a publicly delivered healthcare system, and I'd like to share a few things with you. As a consumer, my mother-in-law was diagnosed as cancer in Ontario, and there was a wait to see the consultant, and then there was a further wait to get her surgery. And after several months, she got her surgery, and then after a few months, she died. She didn't do so well. A friend of our family spent months waiting in line to get an MRI. Finally got her MRI. She had a brain tumor, and she died. Now, more recently, my father, 88 and a half years old, was in hospital with urinary retention, and he needed a prostate operation. And he was told that it was going to be a waiting list of at least 6 to 8 weeks to get that. In the meantime, he had to have a catheter in place. In the meantime, he got a urinary tract infection. In the meantime, he got pretty sick, and he had some pretty wonderful hallucinations, and we thought we were going to lose him. Finally, after a protracted period of time, he did get his surgery, and we're lucky he's still with us, but I think we're lucky. Now, there are a couple things. One, I've heard you say this morning and right now and this afternoon about how you wouldn't sign a bill or at least vote for a bill if it involved increasing the deficit. I can tell you from firsthand experience, when public funds are responsible, are used to fund something like 1/6 or 1/7 of the gross national product, and that's a lot of money, as you well know. And money is limited. I mean, you told us how tough things were economically. We all know that. Where is this money going to come from? I mean, it's either come from taxation, or to borrow more money from the Chinese. Now, I know from personal experience that you're either going to raise taxes, you're going to borrow money, or you're going to restrict programs. And this is the way things have been in Canada for 39 years, and will be the way they're going to be here too, under a similar sort of situation. Everybody talks about public health care in Canada, and I know Canada got pretty good, breast cancer and prostate cancer rates. Not as good as here. We happen to have the best in the world. But
keep it that way.
Yeah, and in any case, anytime anybody talks in Canada about the healthcare system, they're not talking about how wonderful it is. They're talking about trying to reform it. They don't like it there either. Now, President Obama I've seen a tape of him from 2003 saying how he prefers the one-payer
and
system.
your question is?
I'm getting to this. President Obama has said how he prefers the one-payer system. He said that at least in 2003. And I've heard him say more recently that nobody's talking about government takeover of the healthcare system. Well, look at page 16 of the bill. And there's only one bill that I'm aware of.
And the
question is, it says right there on page 16, this is a system that will funnel everybody into a public system one way or another. And I'd like to know, is the president lying? Is he confused? Has he not read the bill?
I want to see the exact language of page 16 or whatever.
Take a look at page 16, but I do a public system. And I can tell you this, that if it's any language like that in the Senate bill, which, as I've said to you, hasn't been written, I'm not going to support a bill that goes into socialized medicine. Not going to support it. The public option is an option so long as there is a private option. When you talk about a public option, you mean it is an option or a choice, but there are other options as well. Who has number 5?
Up here, 5. Up here.
Okay.